Welcome back. We're now coming up on the end of Black Maternal Health Week, a time to focus on creating equity for mothers of all racial and ethnic minorities. Black women said to be 3 to 5 times more likely to have a maternal death than white women here in the United States. Here to talk more about this important topic is Latham Thomas, a celebrity doula, maternal wellness expert, and founder of Mama Glow. Good morning to you.
Good morning to you. Thanks so much for having me.
Thanks for being with us. Tell us more about Black Maternal Health Week and why this is such an important topic.
So Black Maternal Health Week is April 11th to 17th, and it's a time when the Black Mamas Matter Alliance has convened people who are stakeholders in Black maternal health, folks who are committed to changing the statistics. As you mentioned, Black women are 3 to 4 times more likely to die during childbirth or due to childbirth-related causes in the United States. And in places like New York City, that number spikes. In places like Chicago, that number spikes. And so it's really critical that we have legislation in place to address the policy gaps that make it so that this issue is still on the rise. Right now, what's really critical is to make sure that we have access to better care, that we address racial disparities, we address medical bias, and that we address the opportunity and the importance of having doulas and more midwives to address our care, especially for those who have people who also are at low risk, for birth.
Let's talk about the reason of those higher death rates in New York City and in Chicago. What's sparking that? What's behind that?
Yeah, so a lot of people report experiences of being neglected, being dismissed in their care, having hurried care or rushed care, not feeling seen or heard, also having their pain dismissed. And so a lot of folks also end up being underdiagnosed or misdiagnosed, especially during COVID-19, where we've seen a lot of our care become virtual, where people are missing very important health markers along the way. And so these are some of the things. But when we look at the issue, it's not just what's happening inside the pregnancy, it's systemic issues outside the pregnancy that sort of leave us vulnerable health-wise. So we're talking about the lived experience of racism and how that shows up and weathers the body. When we talk about poor access to care based on where you're located in the city, when you think about the providers and the type of care that you can get, there's about 35,000 OBGYNs in this country, and only 2% of them are Black, right? And then we think about midwives, we have 14,000 of them, 6% are people of color, and 2% of them are Black. And so what's really important is to also increase the numbers of care providers that are of color to also be able to provide equitable care to people that are suffering right now. So we want to see equity in birth, but in order to achieve that, we need better education. We need to address the racial disparities. We need to address also the types of medical institutions that people are entering into, and make sure that there's accountability when a maternal death or near miss occurs.
Gotcha. Well, for more information on what you do, go to mamaglow.com. Thanks for being with us this morning, Latham. We appreciate it.
Thanks so much for having us.
Thank you. More on Good Day Saturday when we return.